Hello, welcome back. The topic today is gastric ulcer, the complications, or if untreated, what will happen. So, we all know peptic ulcer, gastric ulcer, duodenal ulcer are all nothing but ulcer or there are wound. Suppose we have a wound here, we call that ulcer in the hand. The same wound, if it's within the stomach, it's called gastric or stomach ulcer. So this ulcer is it's almost bathed in the acid. So that is why it causes pain and all. So suppose if it's untreated, suppose you ignore it, what will happen? So first and foremost is it can give you pain. All of a sudden the pain can come, some irritation. So it can really disturb you at any time. Suppose you're working and the pain comes, it can disturb your work. And if untreated, like morning time when you wake up, you'll give nausea, vomiting feel. So when you have always nauseous, so the quality of life is gone. And because of the vomiting and nausea, probably the food intake will come down. So when the food intake comes down, you lose weight, or even you can get into nutrition deficiencies. This can happen. In some ulcers, they eat a lot and they gain weight. So this is one part. And they will be very choosy because of the ulcer. They become very choosy about the diet. So they cannot mingle with others, or if you go to the party, they won't take the normal what others eat. So they have to order something different, or even at home. So it's very difficult. Sometimes it's very irritating for the others to prepare special food for these people. This is a simple problem. But the next is a ulcer. It's a wound, so it can bleed anytime. If it's a very simple one, it's a chronic bleed can lead to anemia, and even over a prolonged period of bleeding. And with the nutrition deficiency, iron deficiency can happen. So how it will present? They will be tired, they'll be irritated, they'll be losing weight. You know, these things can look into whether the patient is bleeding or not. And very acute bleeding sometimes can happen. It could be life threatening, or even some good quantity of bleeding is happening. It will look like, the motion color will change. That is what the doctors always ask: what is the color of your stool? What is the color of your motion? Whether it is black. So the black tarry stool is nothing but an ulcer is bleeding in the upper part of the GI tract, where acid is also mixes. When it comes down, it becomes black color. So it's a sign that you are bleeding internally. So the next thing that can happen is the ulcer can erode. Actually, it's a wound. When it erodes, it can completely penetrate the muscles of the stomach and become a hole, like a perforation. Then it becomes an emergency, life-threatening emergency. Infection, peritonitis happen, and it's an emergency surgery. And sometimes these ulcers, they can cause strictures, like because of the repeated attacks and repeated healing, the scar formation happens and the stricture can happen. So it can obstruct the flow of food acid. That's called gastric outlet obstruction, or intestinal obstructions can happen in a chronic stage. The next thing that can happen is, adhesions. Like because of the inflammation, there's always this inflamed area. The nearby structures all will be affected, and the intestine, the gastrointestinal tract, will get adherent to the nearby structures like your liver, like your spleen, pancreas, the gastric abdominal wall. So these can lead to chronic pain, unexplained or untreatable pain because of the ulcer. And very rarely, if the ulcer is not treated, and if the gastric ulcer is because of H. pylori infection, there is a possibility of gastric cancers also. But with the advent of ranitidine tablet, the H2 blocker, almost these complications are all almost gone. With the advent of the pantoprazole, rabiprazole, the PPI medicines, almost the surgery for peptic ulcer disease is completely stopped. So if you have ulcer, take it seriously. Go to a doctor, let him examine, let him do investigations, look for what is the root cause, and treat yourself and be healthy. Thank you.